In Northern Ireland, women aged 25 to 49 are invited for a routine cervical screening test every 3 years. Those aged 50 to 64 are invited every 5 years. The screening test is often called a smear test, and it aims to pick up any changes in the cells of the cervix, which may develop into cancer if left untreated. All women are sent their first invitation to attend for screening shortly before their 25th birthday. You will also get an information leaflet which explains what the cervical screening programme is all about. When you receive your invite, you will need to make an appointment with your GP practice to have the screening test done. This is usually carried out by the practice nurse or female doctor. You should avoid having the test done during your period. The screening test should only take about 10 minutes. The person carrying out the test will first of all explain the procedure, and you can ask them any questions you may have. Once you're happy to go ahead with the test, you will be asked to undress from the waist down and lie on your back on the couch. An instrument called a speculum is gently inserted into your vagina so that the nurse can see your cervix. The practice nurse will use a small soft brush to wipe over the cervix and take a sample of cells. The head of the brush is then rinsed in a small container. The test should not be painful, although you may feel some slight discomfort. The sample is sent to the laboratory to be examined under a microscope, and the nurse who carried out the test will tell you how to get your results. You should receive your screening results within 4 weeks of the test. In 9 out of 10 cases, the results are normal, and you will be invited for another screening test in 3 or 5 years' time, depending on your age. If there aren't enough cells to provide a reliable result, you will be called back to have a repeat test in about 3 months. If the results show that there are some low-grade changes, called borderline or mild changes, a test for human papillomavirus or HPV will also be carried out on your sample. If high-risk HPV is not found, you are at very low risk of developing cervical cancer, and you do not need any further investigation at this time. You will be invited to have another screening test in 3 or 5 years' time. If high-risk HPV is in your sample, or if you have high-grade changes, you will be referred to the hospital for a colposcopy examination. It is still unlikely that this is cancer. The colposcopy clinic is usually located within the hospital outpatient department. Colposcopy is a simple examination of the cervix using a specially adapted microscope called a colposcope. It lets the doctor or nurse look more closely at the changes on your cervix to decide if you need treatment. Before the examination, the doctor or nurse will want to ask you some questions about your periods, the type of contraception you use, and any other illnesses or operations you have had. They will explain the procedure to you and answer any questions. You will be asked to lie on a special couch. The instrument inserted into your vagina is the same as the one used for your screening test. Similar to the screening test, you may find it a bit uncomfortable, but it is not usually painful. A light is shone on the cervix, and the doctor or nurse will look through the colposcope to examine the surface of the cervix. The cervix will be dabbed with liquids to make any abnormalities show up more clearly. A biopsy may be taken from any abnormal areas and sent to the laboratory for examination. Your colposcopy usually takes 15 to 20 minutes, but you need to allow up to an hour for your visit. The doctor or nurse may be able to tell you immediately what they have found and what treatment, if any, is needed. Otherwise, you will be given an appointment to come back to discuss the results of any biopsy or any planned treatment. Most treatments can be performed as an outpatient under local anaesthetic. For more information on the cervical screening programme, please see our range of leaflets and our frequently asked questions, which are available on our website.